So let's talk about semaglutide and tirzepatide, the miracle hype drugs that everybody is talking about these days. Assalamu alaikum, my name is Dr. Uruj Yasir Khan. Semaglutide, commonly known as Ozempic, is now available in the market by many brand names like Sempi, like Seglutide, and tirzepatide, commonly known as Mounjaro, is now available with common names like Zeptide, like Terzi. These drugs are majorly used for weight loss as well as diabetes management, and they are miracle drugs being prescribed by various doctors, and they have shown positive results. There is a lot of talk about who actually needs these. Are they good for you or are they not? And I asked you in my previous video, and many people wanted to know more about them. So I thought, why not come up here and share some pertinent information with you all. Semaglutide is a GLP1 agonist. It helps to reduce your hunger, it improves your insulin sensitivity, and as a result, by major clinical trials like STEP, it has been shown to reduce your weight significantly, about 15% of your body weight over a period of 1 year as compared to no medicine at all, as well as it has helped reduce cardiovascular risk factors and improve your diabetic control. On the other hand, tirzepatide has a dual action. It acts as a GLP1 analog as well as a GIP1 agonist. That is, it helps to improve your insulin sensitivity even more, helps to regulate and release your hormone insulin, which is the primary hormone responsible for the management of blood sugar. Now, because of the dual action, trials like SURPASS and SURMOUNT have shown that tirzepatide causes an even greater weight loss. It is about 20% as compared to placebo, as well as the blood sugar level improvement, the improvement in insulin resistance is greater. So yes, if you see it that way, tirzepatide has a better action, has a greater benefit, and the weight loss seen is much bigger. Now, who are the people who deserve these drugs? Who is supposed to prescribe them, and what is going to happen as a result? So people cannot be just getting them to lose a few inches or few pounds over the counter. It's not like that. It has to be prescribed by a proper doctor, ideally an endocrinologist or somebody who is dealing with your disease. If a patient is using it for diabetes, if a patient is using it for weight loss, if a patient is using it to cope with polycystic ovarian syndrome, so it has to be prescribed by your specific specialist, by your specific doctor, because only the deserving candidates should be getting these drugs. There are a few things that need to be considered before prescribing these drugs. These drugs should only be used for patients who actually deserve them, patients who need to have a good glycemic control where other things are not working. A few things need to be ruled out. You should not be having a family history of thyroid cancer, should not be having any pre-existing liver disease, gallbladder disease, or pancreatic disease, because those are the diseases that could aggravate with this drug. And then thirdly, it is very important that you know what the side effects are associated with it are, so that you are able to comply with it in the long term. Because these drugs are slowing your gastric emptying, they are slowing your gut and giving signals to your brain, so you remain fuller for a longer period of time, your appetite is suppressed, you eat less. So the most common side effects seen with these drugs as a result are nausea. People who eat more than they require, they could have vomiting, diarrhea, or constipation. And then along with that comes some fatigue, some restlessness, etc. These are the side effects that vary from patient to patient, and that depends on you and how you tolerate and how your dose then starts to build up. Now, you must have seen a lot of talk and hype about the side effects and people stopping the drug because they had to face certain issues. One was about sudden blindness. Well, that is not true. These drugs are not associated with any kind of blindness. Yes, if somebody had pre-existing eye disease, retinopathy that can develop as a result of diabetes, and they are prescribed this drug without proper pre-existing workup, in their case, because this drug lowers blood glucose levels, their diabetic retinopathy could aggravate and they could lose their vision, but that is usually temporary, not permanent. And somebody who's got thyroid cancer, we are trying to be careful not in prescribing them, because human studies have not shown that result, but it has been shown in rodents. Other than that, because it causes some gastric paresis, it could aggravate your gallbladder or existing liver disease or pancreatitis. Those are the major reasons where you're not going to be prescribing this. Other than that, these drugs are amazing for the right candidate. They are very promising in controlling your weight, managing your weight, your blood sugar levels. The studies have shown that they also reduce your cardiovascular risk, reduce hyperlipidemia, improve your overall health, improve your overall well-being, also help reduce depression and your appearance related issues that you're facing. So yes, these drugs are amazing, were prescribed to the right person, by the right person, under the correct guidance and taken properly. So if you're a deserving candidate, in your view, go visit the relevant doctor and get it prescribed, and maybe it helps you achieve the goals that you're looking for and unable to achieve since such a long time. Thank you.